The first one deals with the process with which the government is doing a major, what appears to us, a major health reform that we know piece after piece what are the goals and the aims the government is looking at. Unfortunately, the whole picture is not clear. And what we ask is to act with more transparency and to have access to the whole picture, to know exactly what is the ultimate goal, the end point that is reached by this reform, and all the steps that is going to lead us to this end point. The second point deals with Bill 20, which has been recently presented before the National Assembly. That has two aspects. The first one is the access to physicians, especially family physicians, and also some specialties that is going to be identified in the bylaws that is supposedly be presented in the near future. It is clearly a bill that is aimed to impose some quotas to physicians. Otherwise, if these quotas are not met, there will be a punishment by the way of the income of the physician. It is one other coercive measure that is proposed by a government. We face many of them in the past, also with incentives, and all of them, unfortunately, didn't solve the real problem, and it is a real problem that we recognize, the accessibility to physicians. A problem that its roots are very complex. It is not the responsibility of only one actor. We probably are all responsible for this situation. This is why and this is our third key message, we want every stakeholder to find practical solutions that will solve the problem in the long term. And these solutions exist. It is not by coercive measure that we probably will find the answers. It is to help physicians and all the professionals to have the tools to provide the services to the people. And the tools are known. We talked about advanced access to medical records, electronic medical records, access to Dossier Santé Québec, work with other professionals. Probably if we promote a tandem between a nurse and a physician to take care of a group of patients, it would enhance the accessibility to patients. There should be some arrangements with specialists to have access to them more rapidly. And so there are a lot of tools that can be promoted and implemented in order to increase this accessibility with the resources currently available. The second part of Bill 20 deals with ART, the assisted reproduction technology. This program was implemented in 2010 in order mainly to reduce the secondary effects of these techniques, especially multiple pregnancies. The goal was clearly to reduce the number of multiple pregnancies related to IVF. And this result has been reached, as a matter of fact. But the problems is probably still present in other areas of reproduction technology. And this is why the college has decided to develop a guideline, whatever the services are covered or not by the public system, to be sure that all the good rules and the good practice is promoted. Not only that, but our perinatal issues committee is going to monitor the application of these guidelines in order to have data and to be sure that side effects are avoided. And one of the problems with the bill is that there is a confusion between the criteria that give access to public funding to patients with the norms of practice. And unfortunately, science is more broader and more complex to apply than the rules actually proposed by the bill. And this is why we recommend to the government, and we will have the occasion to say it in a parliamentary commission, to divide the criteria to have access to public funding from the norms of practice and good practice that should be left to the college, for which it is the mission. And finally, Bill 28, that is currently under scrutiny at the Parliamentary Commission, that is proposed by the Ministry of Finance, as a matter of fact. There are some aspects of this bill that may have an important impact on the health system. The first one is one that deals with the power given to the Minister of Health to retire from the salary mass negotiated for insured services, to remove that from the salary mass and to put it into the consolidated fund of the government. The problem with that is that what are the next services that are going to be uninsured? There is ART, there are pharmaceutical services, are there other that are planned? And if so, we are come back to the first message. What is the plan of the reform? And what is the goal? And what are the steps that is going to leave the implementation of this reform? The second point deals with the negotiation of the price of pharmaceuticals with the companies. There are 2 articles that says that the Minister of Health can do secret arrangements with these companies in order to have drawbacks from the companies, and ultimately the citizen will have to still pay the full amount he has to pay according to the price list of the medication. And finally, the last point is the cover of the pharmaceutical professional services, for which the Order of Pharmacists made representation last week before the deputies, saying that it may lead to accessory fees in the field of pharmaceutical services. So a lot of questions for which we have no answers yet, and for which we ask to have more clarity and more transparency. Thank you.